Now, in this discussion, our panelists will explore the intersection of consumerism and personalized care. So what is currently working or relevant from a consumer perspective in healthcare?
I'll first start off by saying, I've been 25 years as a healthcare executive, so I think consumerism, I'm not very good at it. The industry that I've been part of for 25 years, we might use those words, but we're really not trained in it the way that people who are in consumer-driven industries really understand it. So to answer your question directly, I don't think we're very good at it. I think we want to be better at it. And I think that right now, the metrics that we have still are largely aligned to a traditional healthcare system that takes care of sick people versus how we really look, as many people have said, holistically at what a person needs, not just a patient.
So with that in mind, you told me that you thought you can be a better influencer of change being outside the industry than inside of it.
So I think we are really patient-centric, but I think where we're missing it is that it's person-centric on the clinical, right? And so what I've spent a lot of my time doing since I've retired from a big healthcare system is to really understand the drivers of health. And if you look at the drivers of health, Glenn, in the research, and it's out there, I know not everybody likes it, but it's there, and I'm a big data person. Our health drivers are 10% clinical, 20% social, 30% genetic, and 40% are behavior choices. Now, mental health is incredibly important. That is actually part of the clinical bucket. And then longer term, we need to have a definition of health, and I heard some other folks say this, that encompasses all of those drivers. Healthcare is one piece of that, but we need to change the definition of health so that healthcare is seen as a convener of things and a participant in a bigger system that drives our health, not just sickness.
Christine, I want to jump in just let's tackle this one. So when you've come from the outside in, what do you see as the most immediate opportunities to begin shifting our mindset towards understanding what consumerism means in healthcare?
I think from my perspective, I think about what's going on e-commerce and direct-to-consumer sites. And for the last 5 years, they've been focused on omni-channel. Your experience has to be the same. But then it became very clear to me that we have no consumer profile. We have no target consumers. I don't know if others see this, but over and over again, I hear our target is everyone. If we don't have a distinct consumer persona and target and segments, if we don't understand who's the highest priority, that doesn't mean we're turning anybody away from clinics or EDs or surgeries. But if you don't have that crystal clear who is the top of the target, how do you build experiences? How do you negotiate partnerships? How do you have a unique brand? And so I think e-commerce is teaching our consumers to expect the same thing in healthcare, in omni-channel, whether it is telehealth, whether it is a clinic, whether it is an urgent care, whether it is a hospital, that it's personalized. You walk in, your records are there. You don't need to talk about your prescriptions 20 times over to 20 different people. It's that elevated experience that I think consumers are going to drive the industry, whether we call it value-based or whether it is just that absolute continuum from wellness all the way to critical care. They're going to drive us there.
Well, and Christine, I think what you're talking about is reducing the friction in the experience, right? And I think looking at the patient from the whole experience, from the onboarding to the checkout, as it were, and reducing the pain points throughout that process are really, really crucial.
So how does a healthcare organization and their boards meet the needs of all these consumers? Now, Stacy, I know that you have a particular passion about the role that boards play in this equation.
Yeah, I do. And as we know, the board and senior leadership sets the tone at the top, and then the organization follows. I think in terms of defining the consumer, I couldn't agree with Christine more. And I think that's actually a real opportunity when folks outside of healthcare systems join the leadership team, because they bring a perspective that the rest of us don't have naturally. And I think that the board also needs to see specifics, both good feedback from patients, providers, staff, payers, et cetera, but also, some of the warts. I think they need to know what are the experiences of each of those customers in the system.